So, good evening, everybody. I'm Dr. Srikanth, cardiologist working at Tirupati in Padmavati Cardiac Clinic. And today, my topic which I am going to discuss is understanding heart attack. So, what is heart attack? What are the initial symptoms of heart attack? And what is the importance of time of identification of heart attack? And the last thing which I am going to discuss is how to prevent heart attacks. So these are the things which I am going to cover. And initially giving an introduction of heart. So heart is a continuously working machine in our body which works in day and night, and usually it beats around 70 beats around averagely at 70 per minute and pumps 5 liters of blood per minute. This is the basic function of heart. So it is a continuous working machine and it needs continuous blood supply to the heart so that it works continuously. So for having a continuous blood supply, heart has its own system of blood system that is called coronary. These are called coronary arteries. So the coronary arteries arise from aorta. So the blockage in the coronary arteries, heart attack is a leading cause of death all over the world, and it stands in number one position. So this is the burden of disease in all over the world. In India also it is very high, and we don't have a good data in India, but they say that in India the heart attack occurs at an younger age, less than 40 years, and there is more mortality when compared to Western population. This is what they say in Indian subgroup. To the heart attack is nothing but it occurs when the blood supply is cut off to the heart. So I will simply demonstrate by this diagram. So the heart contains its own blood supply. These are called coronary arteries. So this is the enlarged image of this coronary arteries. This is the normal coronary artery which I am showing. So this is a continuous process of disease. So this what you are seeing, this yellow portion is called atherosclerosis or lipid deposition in the coronary arteries. So once the endothelium which is here is present gets damaged, the endothelium is the police or a protective layer in the arteries. It gets damaged due to number of causes. So one of the causes which I can say is blood pressure, high blood pressure or filters. So these are the causes which can damage this layer. Once this layer gets damaged, you will get next stage of disease starts. That is, lipid gets accumulated in the blood vessel. The disease. So the amount of stenosis gradually progresses. It starts from 20, 30, 40, 70, 80. So once the percent of stenosis reaches around 80 to 90%, the capacity to contain this cholesterol or lipid content within the artery is not maintained by this membrane. So it gets burst. So once it gets disrupted, that layer endothelium gets disrupted, the whole blood supply to the artery whole blood supply in the artery gets cut off. That is, this situation is called myocardial infarction, that is heart attack. So the heart attack occurs. What are the symptoms which the patient should be identified and which he should know? So initially what I am going to stress is, usually whenever the patient has a heart attack, there are number of causes for chest pain. So you should identify some features of chest pain that very much correlate with heart attack. So usually the heart pain which occurs due to heart attack is usually centrally located, and it is usually around a fist size, and the duration of the chest pain is also important. Usually it is more than 20 minutes, and the chest pain usually gets progressed. It doesn't subside, it goes on, increases and goes on spread. Usually it spreads from here to the left shoulder and left arm, and sometimes it also radiates to the neck or It goes upwards towards neck or to the back of the chest. These are the symptoms which you should identify. Once the chest pain is radiating like that, if you are having other symptoms like vomitings, sweatings, excessive sweatings, giddiness, or vertigo, all these symptoms will be associated with chest pain or breathlessness. These are the symptoms which is commonly associated with chest pain. Once you have these symptoms, you should take an you should contact a nearby health center so that you will get contacted with the medical system. This is called first medical contact. First medical contact is very important. One, this will FMC. Once FMC occurs, ECG is the simplest investigation, costs around 150 rupees, from which we can diagnose myocardial infarction. Once myocardial infarction is being diagnosed, it is an emergency situation where other investigations are needed, like echocardiogram. Sometimes ECG may be normal initially. So once you have chest pain, then it needs to be evaluated thoroughly, like echo, treadmill, depending on your troponin levels, and the final diagnosis of this vessel blockage is done by coronary angiogram. That is nothing but a test where you will diagnose the blockage of the arteries. So once you have myocardial infarction, there are some medications which can be used, like antiplatelets, that are called blood thinners. That is called aspirin, clopidogrel, are the blood thinners which commonly used in myocardial infarctions, and we will be given some statins, some other drugs. And in myocardial infarction, the emergency drug which is given is the streptokinase or tenecteplase. These are called thrombolytic drugs. Very important. These are given in ICU setup. Once the time of onset and the time of giving the drug is very important. That is called golden hour. The first 1 hour after you diagnosing heart attack is very important, because most of deaths occur in first 1 hour. This is called golden hour. If you are missing this hour, you are losing muscle. That you are losing the valuable heart muscle. That time is muscle. So once you should not miss this golden hour. So this concept is not there in India. So everyone should be very knowing that this golden hour is very important. So there are a number of modalities for myocardial infarction which I am not going to discuss. But what are the things which are helpful from preventing heart diseases? That is, I am going to elaborate. One is, you should have a regular heart checkups after the age of 45 or 40 years. That if you are hypertensive, if you are having a diabetes, if you are having a family history of coronary artery disease, these are the important points which you should know, and have a thorough cardiac evaluation after the age of 40 years. So the number of habits will help you from getting heart attacks. One is checking your blood cholesterol regularly after 40 years, and need of statins, that is the drugs which are used for should be discussed with your cardiologist. This is the only drug. And maintaining an ideal body weight is also very important. Obesity is also one of the causes. And reducing your risk factors like that, like stop smoking and avoid alcohol, have a regular exercise, make a part of make an activity in your life, so that you will have a 30 minutes of small walk in your daily activity, so that you will have a good exercise every day. Another important thing is avoid foods which have high cholesterol levels, avoid smoking, and avoid alcohol. These are the important things which help you from preventing the getting heart diseases in you. Another important thing is have a regular checkup of blood pressure. Blood pressure also will not have any symptoms unless you get checked. These are the important things which will help you from not having any heart diseases in future. Thank you.